you probably should exit, but there is no security concerns with being recorded unless you say your name and say something crazy. If you could all keep yourselves muted while the meeting is going on, you can unmute yourselves to ask questions. We don't have a moderator at this meeting, so feel free to unmute yourself whenever you have a question rather than using the raise your hand feature. Just unmute yourself and be polite, of course. If you do have a question or do need to state a resource or anything, please state your name and your affiliation so that others know who you are in case they would like to get in contact with you after this call. All right, and so with that, I would like to first begin by introducing myself to everyone that's on the call. My name is Taquine Brookins, and I am the founder and chief operating officer of the Minority Freedom Community Fund. We are a newly established nonprofit organization with a national focus, but headquartered here in Detroit, although we are 100% virtual, which works out right about now. Our mission is to improve the lives of minorities across the country through economic support, social programs, and holistic wellness. I have on the call a couple of my board members. All of them are welcome to speak, but I would first like to introduce our president, Nakia Powell-Thomas, to give a quick welcome.
Hi, everyone. Once again, my name is Nakia, and I'm the president of the Minority Freedom Community Fund. I just want to thank everyone for joining us today. A special hello to anyone that is participating with us for the first time. We welcome you. We have a wealth of information to share, and it's going to be a great meeting. So thank you all for joining.
Thank you, Nakia. Do we have any other board members on the call that would like to introduce themselves or say anything? Not required, just inviting you. Okay. And so just to quickly go over our agenda for today, we've already done the welcome. I wanted to quickly give some updates on the progress that the task force has had since our last call, as well as some of the legislative changes and the implications to people in the community. So I will be giving a quick report, but then we'll spend the lion's share of the meeting, as always, with just an open discussion, talking about ideas, sharing resources, asking questions. I have probably been on, since this is our fourth community conference call, if you will, since we decided to establish this task force. And I could say I've probably been on maybe 70 webinars, conference calls, trying to learn as much about every single aspect of the laws that are passing and the concerns that are coming up. And so trying to stay educated, stay informed, to getting information from multiple different sources to eliminate some of the bias that exists in the media, so that I can be able to share that information with you. And so I'll try to share a little bit of it, but again, any questions that you have during the Q&A session, I will be happy to go into detail about any of the things that I touch on or don't touch on, because just because I don't touch on it doesn't mean that I haven't been researching it and informing myself about it. We're just limited on time, and I don't want to hog the meeting. And so just a quick update. We have established a emergency assistance application that we have been using to provide emergency grant dollars to individuals in the community as they await other forms of assistance, whether that be the so-called the stimulus check that the government says that they're sending, or any unemployment benefits that they're awaiting on. And so to date, since I think April 2nd, so it's April 8th, and we rapidly developed the application on April 2nd, We've had about 4 or 5 applications already without even promoting it, just through word of mouth from one applicant. We've granted $700. We've raised $1,600, a little over $1,600, but we've received about $1,400 or over $1,400 in requests. And so we've been trying to be very prudent in our expenditures from that fund, just because we know it's very early on. We know that the need is going to continue to raise, to increase as more people experience tragedy because of what's going on. And so we're trying to exercise caution in how freely we're giving out those funds, while still being responsive to the community. And so to help alleviate some of that, we have a couple of grants that are in the hopper with some foundations, one being the United Way for Southeastern Michigan. I was in communication as early as 6 o'clock with their community outreach person in regards to a request that we had in, just explaining the purpose and use of the fund. So I'm really hoping that we do receive that assistance to be able to fully fund some of the requests that we're getting. We also have a zero interest loan application that we are offering the community. This is our way of still trying to meet the need, but understanding that we are a new organization, we're small ourselves, and we want to make sure that we can maximize our impact. And so offering zero interest loans, not as a way to make any money off of it, so we don't charge origination fees or interest or prepayment penalties or anything like that, but it's just a sort of way for people who borrow from us to replenish the funds so that other people who are in need, when they're on their feet, can benefit from those funds. So that's an update in regards to the task force. We also organizationally, we elected 4 new board members as of yesterday. I think at least 2 or 3 are on the call today, so hello to you. And then we also have a new committee member as well. Last but not least, we did speak to a consultant in regards to an idea that we have as we think about the way that we want to position ourselves to assist the community as they respond to all the devastation that is happening because of the coronavirus pandemic. One of the things that came up was the idea of how can we best support people financially through the Community Reinvestment Act program that banks offer. And so we just talked to a consultant last week, but our finance committee internally is going to be looking into ways that we can leverage a banking relationship to allow the Minority Freedom Community Fund to help inform some of the programs that banks offer to low income or moderate income minorities. And so that's a quick update that I wanted to give in regards to what we've done. I also wanted to go over some recent legislation just to clarify some things that have passed in our favor, and also give a PSA. So I'll start with my PSA. One thing that I will continue to do at each of these calls is, we started it last week and I'll continue to do that, is to just quickly give a synopsis of what to do if you are sick or suspect that you have been exposed or have COVID-19. The very first thing that you want to do, we've all seen the signs of what to look out for, so I won't repeat that type of information, but I want to get a little technical in regards to what to do when it happens. So the first thing that you do if you start to experience any of the symptoms that they talk about and they start to get severe, you want to contact your primary care physician. If you do not have one and you have insurance, so you don't have a doctor that you go to regularly, but you do have insurance, you can call your insurance provider and your insurance provider will give you a referral. If you do not have insurance, you can contact or reach out to a federally qualified health center and they will be able to assist you. They will not, if you are an undocumented citizen, for example, they will not report you to any authorities. And if you are a citizen but just don't have insurance, that is just another option for you. Secondly, when you call your primary care physician, you'll have to get a prescription to get a test, typically. So there are some cases where you can sort of force your way in, but to a hospital to get care, but that is a very mundane process. I've heard very firsthand accounts of people trying to do that, and it's highly recommended that you try to get a prescription first. You can contact your local health departments. I know Detroit has free transportation available to people who are going to either get testing or see a primary care physician to get a prescription or get looked at in response to COVID-19. So contact your local health department. What I would recommend everyone do that is on the call, and you can also spread this information, prepare. So you can get a little small Ziploc bag or something and put in that your ID and your insurance card and maybe the phone number to your health department. A lot of health departments have a COVID-19 hotline. Detroit has one, and I'll share that number later on. But get everything that you need in the event of a COVID-related emergency together, and put it in a Ziploc bag or a baggie and put it on your fridge with a refrigerator magnet, or put it somewhere by the door, or somewhere that's easily accessible by anyone in your home, and talk to people in your house about it to let everyone know where it is, what it is, and why it's there, so that you can sort of start to develop an emergency plan in your home. I also want to encourage you all to stay healthy, so make sure that you're resting. I know it's really hard for some people. I can't relate, but it's really hard for some people right now to sleep, to get their regular hours of sleep, because they're staying up late, because they're not really active during the day. But the best thing that you can do for your body to help to fight off any infection or disease is to make sure you're well rested and make sure that you're eating right. I know a lot of people are using this time to indulge as well. So I just want to encourage you all to be mindful of what you're putting into your body and how you're treating your body, because your body's natural defenses are going to be your first line of defense in any case. Also, stay mentally healthy. We talked about some things that you can do to sort of prevent some of the stress of what's going on from getting you down. There is, most insurance providers now are offering free telehealth, so you can have access to therapists or counseling in that way. There's a virtual network of therapists that offer virtual therapy sessions that we've shared, and I can continue to share. Make sure that you spend some time away from the television. If you are watching TV, watch shows. Don't watch the news unless, obviously you want to stay informed, but don't leave your news on all day long. This is just a tip. You can leave the news on all day if you'd like. And also try to exercise your brain. There's a lot of free courses that are available to people right now if you want to brush up on some skills that you have been wanting to acquire or strengthen. Now's a great time to do some of that. So that's my PSA. I'll be happy to answer any other questions that you have in regards to that stuff, but I just wanted to get that out of the way. The next item that I wanted to talk about all relate to the legislation that pertains to coronavirus relief. And so I want to first say and encourage you all to contact your local Senate offices to voice your concerns. The most powerful thing you can do is to self-advocate and advocate on behalf of those that can't speak for themselves. So I encourage you all, if you do not know your local Senate officers or local Senate office number or contact information, we can help you get that. I'll talk about locally in Michigan and Detroit, those numbers. But for people that are out of state on this call, I encourage you to self-advocate in that way. I also want to inform some of you, and some of you may already know, that they are working on a fourth round of coronavirus-related relief. As early as tomorrow, they're drafting a bill that the Senate will be looking at. They're going to be expanding some of the bill is a result of some advocacy that has continued to go on after the last bill that passed, to make sure that people that were left out of that round of relief are included. And so I know a big question around the stimulus checks that are coming out. A lot of people aren't included in that. So there's been tons of advocacy around that, as well as things like student loans, making sure that we expand the relief on people who get student loan deferrals or forbearance during this time. So I'll talk specifically about that in a moment, but I just wanted to first mention that they are working on another round of relief for people. And so just a couple of the existing legislation that I wanted to highlight for you all. Again, all of this is happening so fast that many of the rules are changing literally overnight. And so this information, generally speaking, is probably good, but just know that it is subject to change if it has not already since last night. And so one thing that I wanted to discuss is in regards to some of the relief for nonprofits like churches and organizations like ours, as well as sole proprietors or business owners. There are a couple of forms of assistance that apply to you that you can apply for. One of them being unemployment. So the unemployment benefits have been drastically expanded to include not just people that have traditional forms of employment, but sole proprietors, business owners, people that drive for Uber, people that do hair. All of those people have been included under this new round of unemployment benefits. And in addition to including more people, they're expanding the benefits. So in addition to whatever your state offers, which varies from state to state, I think Michigan, the maximum is $342, but it varies state to state, and that's the maximum. The federal government is also supplementing that with $600 per week in federal unemployment benefits. Most states are coordinating unemployment benefits so that when you apply for unemployment benefits through the state of Michigan, for example, you automatically get access or get applied for those federal funds as well. In addition to unemployment, there are two additional programs. So the Paycheck Protection Program is a program that is, the two programs are the Paycheck Protection Program and the what they call the EIDL loan, the Emergency Income Disaster Loan. I think that's what it stands for, but EIDL. Both of these loans are available through your bank or credit union if they're SBA certified. I do have a list of all of the SBA certified financial institutions in the state of Michigan. If you are not in the state of Michigan and you're on the call, I can also, you can just let me know and I can also get that list from you, but I encourage you to contact your local SBA, Small Business Association office for that information. But I do have that information readily available for Michigan, just for your information. The Paycheck Protection Program is basically what it says. So it's to allow people to meet payroll needs, whether you're self-employed or if you have one other employee. It's for small businesses, so under 500 employees. And the goal of the program is to allow you to meet your payroll demands So 75% of whatever you receive out of that program must go towards payroll expenses, paying yourself, paying your employees. You can allow up to 25% of those funds to be spent on other things like rent or other obligations that you have, but it is encouraged that you utilize the EIDL loan for those items. With the EIDL loan or the EIDL loan, there's a lot of change going on with this. This is the most recent information that I have from a member of the SBA as of yesterday. Originally, they were allowing up to $22 million through this program. It was changed Monday night, I believe, to cap out at 25,000. Which is a big difference. They do have a grant portion of that program. So the first 10, you can request for $10,000 in emergency assistance up to $10,000. So it's based on how many employees you have and your business activity. But that is another option for people. Again, going back to the unemployment piece, if you are a sole proprietor and you have a business, it's recommended that if you make less than $2,400 with your business, that you just file unemployment, since that's available to you. But you're more likely to get funds through unemployment rather than one of the other programs. But you're still obviously encouraged to try to apply. It's just make sure that you apply for unemployment as well. You can apply for both the Paycheck Protection Program and the EIDL loan. If you apply for one, you're not excluded from applying to the other. I'm going to pause for a millisecond before I start talking about stimulus checks. Does anyone have any questions about the programs that I talked about, or you can also wait until we get to the Q&A section of the meeting? In regards to the stimulus checks that the IRS is planning to start mailing out as early as next week, I will reiterate that the stimulus checks are available $1,200 for adults 18 and over. That make $75,000 and less, and that is according to your adjusted gross income. So not your net income or the money that you actually make, but after deductions and all of that, your adjusted gross income on your tax return. If you make over $75,000 but under $99,000, your $1,200 is reduced by $500 per $100. Up to $99,000. So if you make over $99,000 as a single person, or double that for a married couple, you will not receive anything. And again, these are all adjusted gross income numbers. You will also receive $500 per dependent that is reported on your tax return. Just want to reiterate that dependent must be reported on your tax return. So if you have never filed taxes, never reported any dependents to the IRS in any way, shape, or form, you will not receive funds for those dependents, because the IRS does not have record of that. You can find out more information about stimulus checks if you go to irs.gov/coronavirus. They are TurboTax is collaborating with the IRS to allow for people who do not file taxes or have not filed taxes to submit a form so that they can get their information to the IRS. That is available on the TurboTax website. I can also provide that URL later on during the Q&A. This income is not going to be counted as taxable. And again, like I said, the government is working on another round of COVID relief. There are a lot of people that are left out of this stimulus package And so there's been a lot of advocacy to change the parameters that they're using. And so it is very likely that the next round of relief that will be passed by the end of the month, certainly, will broaden the eligibility of that program. I'm going to pause for a second to see if anyone has any questions right now about the stimulus checks. Otherwise, I'll keep going. I just want to take a minute to talk about an issue that many of us have seen in the news that really speaks to why we started this task force. So there's lots of statistics coming out in regards to Black people being disproportionately infected and dying from the coronavirus. And they attribute this to a lot of different things, from living conditions to poverty, misinformation, underlying health issues. All of those things are why we get together and why we have established this task force, so that we can mitigate and help offset that occurrence. When we first heard, usually when there's a global or a mass pandemic or something major, economic downturn that occurs, we know that minorities are usually harder hit than most other populations. So it's not a surprise, but it just encourages us and should further fuel us to work harder to get information out there, to abide by the stay-at-home and legislations that are passed, and to encourage your families and friends to do the same. I just wanted to give that little pause just to remind us all of why we're doing what we're doing. Back to the regularly scheduled programming, I also just wanted to quickly reiterate the relief relating to student loans. And so for federally held student loans, so usually loans that were made after 2008 or 2010, I forget which year, you can defer them for up to 90 days or through September 30th, actually, and that may change as well depending on the nature of the economy. You do have to reach out to your loan provider or your loan servicer to request that. So if you have not done that already, you should. The IRS is also not or should not be taking any withdrawals or garnishments out of any tax refunds, especially not the stimulus check, but any tax refunds that were dispersed after, I think the deadline was March 13th. And so if you did get a tax refund after March 13 and they took money out, they will be refunding you for that portion. In relation to the impact of the legislation that is already passed on retirement funds, I just wanted to let you all know that you can make hardship withdrawals without penalty from your retirement accounts. And you can also, you still will get taxed on it, but you won't have to pay it with your 2020 tax returns all at once. You can spread it out over a couple of years. And that even may change as they continue to roll out new legislation. In addition, if you're already in retirement and you're subject to the minimum distributions, you are no longer subject to that. So they're not going to force you to take money out of your retirement because of your age at this time. I also just wanted to clarify something in regards to essential business, what an essential business is. So we know that at least in Michigan and in pretty much every state now, all non-essential businesses have been basically told to pause on operations. And so there's some confusion around what constitutes an essential business. And so I spoke with the commander at the Detroit Police Department And essentially any business that is not in business, in a life or death sort of business. So if you're not there to save lives or prevent people from dying, essentially you're not considered an essential business. So if you do hair, if you cut grass, if you're not saving lives or feeding people, or providing some sort of medical care, you're essentially not an essential business and should not be operating at this time. I also wanted to notify those on the call and your communities that there are several utility assistance programs that are going on right now. So at least locally, and you should also check this out in your region as well. But locally in Michigan and in the city of Detroit, they are restoring all water. So everyone who had their water shut off due to inability to pay or whatever the reason, they are restoring those accounts so that everyone has access to water. They will be charged $25 a month. But if you cannot pay that, there are organizations that can assist you in utility assistance. You can also get free internet from Comcast through their Internet Essentials program. The Minority Freedom Community Fund is the Internet Essentials partner. And so if you know a group of people in your communities that do need internet, we are able to help get them access. The only caveat to that is that we need at least 25 people who need service in order for us to do that program. So please spread the word. Also, DTE is pausing all internet, or not internet, I'm sorry, all energy cutoffs during this time. If you or someone you know has had their energy cut off, please contact me. I do have a direct contact at DTE that I've been working with to get people's lights and such turned back on during this time, because even though that's their policy, sometimes their workers are, not, their workers aren't up to date on policies. So if you do know someone that has had their stuff cut off, please let me know. I also wanted to reiterate to check with your mortgage companies. So if you are experiencing any sort of reduction in income, you can usually contact your mortgage company, and it varies from company to company. So I would encourage you to contact yours to see if they have any coronavirus deferment plans available. Also, a lot of states and municipalities are pausing property tax foreclosures. So if you have not paid your property taxes or are unable to pay, there are programs available to help you get back on track, but they're also not allowing any evictions or foreclosures during this time. If you are getting evicted or someone is trying to foreclose on your house, at least in the state of Michigan, you should contact your Attorney General's office to report that entity. And as far as information, so one of the other goals of our task force is to make sure that people are able to understand what information is legitimate versus illegitimate. So I just wanted to notify you all that hospitals, in particularly Henry Ford, are running or trying to start programs to have people in the community volunteer to test out new drugs, a new drug that is supposed to or potentially could cure coronavirus. And so if you hear something like that, I know we hear a lot of things, and so I do want you all to know that that is something that is true. I'm not trying to persuade you to do it or not do it at all. I am just trying to inform you that that is something that is true. So Also, if you, in relation to the stimulus checks or the loan programs, do not pay anyone to get your stimulus check. Do not pay anyone to get access to the loan programs. All of that stuff is free. So if someone is calling you, emailing you, or texting you, asking for money in order to get you on a waiting list or get your stuff approved quicker, anything like that, please know that that is a scam. All of that stuff is available for free. Lastly, I know that last meeting we talked a lot about the kids and about education and about the digital divide, both locally and across the state and probably nationally, as we've known from some of our guests who are from other states experiencing the same things in their school districts. The Detroit Public School District is applying for funding, for federal funding to support efforts to close that digital gap. And so they'll be asking for money to purchase devices and get people internet ready and all of that. Also locally, Triumph Church, I know, has a drive that they're running to allow students to get laptops. I mentioned a little bit about the grant that we have out to United Way for Southeastern Michigan. That grant, a portion of that was to allow us to pay for printing costs for at least one under-resourced school locally. And so hopefully if those funds do become available, we're able to do that. A couple of other things that were in that request for United Way, we asked for additional funding to support our emergency assistance fund so that we can more fully fund some of the requests that we're getting. We also asked for funding to purchase masks so that we can, we have a vendor that is able to make masks and send them to people so that they can go on our website, order a mask, have it delivered to their home for free, and the grant will pay for the cost of making the item and for shipping, so that it will be free for people in the community to get those facial coverings and protect themselves. I'm going to stop talking now that I have probably lulled a lot of people to sleep. Hopefully, I know it's a lot of information, and this was me trying to truncate. Like I said, I probably been to 70 calls, so I have a lot of information in me. I want to remind everyone that we do have an email address, covid@mifreedomcf.org. Where you can forward any resources that you come across, so that way we can share them with people on these calls. But at this point, I do want to open the call up to our task force volunteers who have any updates on any of the items that they have worked on since their last call.
Hi, this is Dr. America Patterson, calling from Washington, D.C. I was referred by Ms. Yukima Brookins. I was just chiming in to see, as far as the face masks, if there is a set number of face masks you need. My nonprofit, we are actually making face masks for the people in Detroit City, and we were just trying to see how we could pitch in and help out.
Hi, America.
Hi.
So no, we do not have a number. So with the grant request that we have to the United Way to provide that for people locally in the city of Detroit, that $500 could get us 200 to 250 masks, including shipping and the cost of the masks. And so we're not intending to place a limit on that, because we know masks are not reusable for the most part, although cloth masks, they say that you can wash them. But we want to make, there's more than 200 people in the city of Detroit, right? So, and in most cities, there's more than 200 people. So we don't have a defined number, I would say. So as many as you're able to do, I think would be awesome. Do you want to talk a little bit about your nonprofit and what you're doing?
Yes, so we have the Healthy Synergy Nonprofit Corporation, and I'm also the president and founder of the America Essence Foundation. So Healthy Synergy basically is an educational-based foundation. We work with children. I'm originally from Detroit, Michigan, but I currently live in the Washington, D.C. area. But we're working with inner city areas such as Chicago, Washington, D.C., Detroit, even in some inner city areas in California. And then the America Essence Foundation awards scholarships for students in Detroit. But, you know, even outside of our focus and our mission, when, like you guys are doing, we see issues like this, which we know the Black community in inner city areas are underserved. We just jump in where we're needed. So similar to what you guys are doing, that's what we're doing, kind of like on a request basis. If people need face masks, so for example, earlier this week we sent out individual face masks that were made and sent those out to the families individually. But next week we're actually sending out healthcare packages, which will include like a thermometer, alcohol swabs, some Lysol wipes, face masks, and things of that nature. So, you know, just any way that we can pitch in, you know, even if it's like you said, if you have a list of people who need face masks, if you want, we can maybe assist in bearing some of those costs for you guys and just mail them out, or we can get them over to you guys, or I can mail them to you and then you send them out. Just, you know, basically trying to see any way we can assist in this process, because I think it's really amazing what you're doing.
Thank you. And I do know that we have someone on the call, I think Tarsha Gale. If you wanted to talk a little bit about your needs, I know that we haven't gotten a chance to talk yet. My apologies. So hello. But our president, Nakia, was talking to me a little bit about what you're doing with CPS and your needs. So if you want to talk about that a little bit.
Sure. Hello, and hello everybody else. First, I just want to thank Nakia for the invite. We connected by way of just me putting some information out on Facebook, and then we figured out we have a common friend and just went from there. So yes, what I am doing is working as best I can. I mean, I currently work in the child welfare field professionally. However, given everything that's going on and all of the accommodations that we have to make for our program right now for foster care and foster care adoption, just thinking of some of the friends that I have who also work in the field, specifically the individuals who I know and colleagues I have that work in child welfare for Child Protective Services, because they are a part of what's considered a task force that has to still be in the field as essential workers. So most of the team that I work with, so my workers are not in the field. We have found different ways to do our foster care work via technology at this time, and have been given that allowance by the state of Michigan with all of the modifications that the state is making. So our department specifically has not been considered essential, but CPS is still essential because, as we all are aware, children who are now at home, in their home all day, every day with parents, and not able to go to school and able to be out in the community, visual to individuals who may actually be able to provide them either with food or with that contact to keep them safe if there is a concern. You know, they're isolated right now. So CPS is definitely still out in the field and working to respond to those calls, which have increased at this point in time for all of our community. So right now I have a fundraiser that I have done personally. So this is separate from, you know, my professional job, but it was just on my heart, and I was just led as I, you know, have been thinking about everything that's going on and looking at some of my colleagues and friends to start a fundraiser where we can raise funds to purchase masks for those essential workers, which are CPS workers that are deployed in the field right now. And then I also have a good friend who works in the medical field. And in a conversation with her, was just talking about how, you know, as our nurses and doctors are on the front line working constantly, they have to quarantine themselves and not be home with their families. So one individual story that I heard was just of, you know, a nurse who has a family and she is not able to go home to her family, but she still obviously has to care for them. So meals for her family was something that she indicated that would be a great help to her. So that's a part of the fundraiser as well. So it's kind of twofold. And since I put it out there, we have gotten a response from some people, a good response within a day or two to raise those funds. I also had a response from someone who indicated that they are making the mask. This is just a person, again, this is just really my connections via Facebook. So a friend who says she would be willing to assist with making them if we can get those supplies. And then another friend who I know had a restaurant locally in Detroit, which obviously is impacted by all the shutdowns. And he was saying that he would be willing to cater some of those meals specifically for the families of our medical people who are out on the front line. So it's just really something that, like I said, it was just put on my heart after I had been thinking about it, and obviously doing a lot of more praying than usual right now. And I just wanted to just put it out there and get it going. So it's really coming together in a good way so far. So I was glad to make the connection with Nakia and be invited here to just share that information and hear everything that you all are presenting. And, you know, hoping that it can just be of support to some of these workers and medical professionals who are in need right now, and specifically in Wayne County where it's the hardest hit.
Absolutely. And I think, so I know we have a couple of people on the call. I'm thinking about Nick and Val, who are also doing some similar efforts. So I don't know if either or both of you want to talk about Fresh Corner Cafe and what you're working on in response to that.
Sure. This is Val. Can you hear me?
Yes.
Okay. Yeah, so we are actually working right now with Henry Ford, and we've been providing meals for the frontline nurses and staff. So far, we've done about 400 meals. We're still in the process of continuing to fundraise. Unfortunately, we can't bear the brunt of the cost of it simply because we're kind of shut down otherwise outside of catering. So it really is kind of, it's nice to see people understanding like the issues that small businesses, especially small food businesses that have had to close during this pandemic are facing. And I like that these are kind of situations where we can uplift each other. We're also working with our church to kind of put together a meal program, especially for shut-ins or senior citizens or larger families, so that we can help provide meals for them and fresh produce in conjunction with St. Vincent de Paul Society. But really, we're open to a lot of things. We know that there is a great need. We're in the process of doing our own fundraising to kind of meet those needs. So if there's anyone that is interested in speaking with me or partnering in some capacity, I'd love to talk about what your needs are and how we can help with that. Just to give you, I guess, a background, Fresh Corner's been around since 2012. Our major mission is to increase access to healthy food options in Detroit. So we've been doing that in a few ways. Traditionally, we started out selling retail prepared meals to gas stations and liquor stores, trying to transform those spaces into healthy food access hubs, understanding that a lot of the times getting food in Detroit is about lack of transportation. So we wanted to meet people where they were, literally in the communities where they were already shopping. We've also done fresh markets with schools and senior housing developments and community centers. And we recently opened a takeout location. So this has been pretty interesting. We're in the process of trying to get that remodeled and all that stuff. But currently the building that we're housed in is shut down. So yep, it's myself and Nicholas, who is also on the call, who happens to be my brother. And that's what
Hey,
we do.
everybody.
So yeah.
Hey, thank you. Nick, did you want to say anything? I did want to kind of introduce you as our one of our newest board members. You and I think Tarsha are on the call, and Dana. So all three of you. And I don't know if the other board member, Nakia, I don't know if she's on the call too.
She wasn't able to make
Oh, okay.
And
So
just the three of them in India who joined the program committee.
So I do want to say hello to you all and give you an opportunity to speak. If you would like, obviously no pressure.
No, not at all, not at all. Well, my sister Val pretty much covered everything, everybody. I'm Nick, Valorian's or Val's partner. So yeah, we're just trying to do our part. We've been in the game since 2012. There's been a lot of changes going on, obviously, from our end, and then more recently, the economy, as we've seen with this pandemic. But, you know, we're still churning forward, changing some things, pivoting like all of us need to. So it's a tough time, but I'm pretty sure we'll all get past it. So that's pretty much it.
Thank you. Thank you. Does anyone else that's on the call have any updates to share before we switch over to our Q&A section?
Hi, I'm Jaquette. I'm actually from Chicago. I'm an educator, a first grade teacher. I live in Chicago, but I also work in Indiana, so I'm kind of like in between both aspects of education. But I did upload different free educational resources for educators and for students. I know we're in a tough time. Trust me, I know as a teacher, we're frustrated. I know the kids are frustrated. I know parents are frustrated. So trust me, I understand from all aspects. What I will say in regards to the kids, you know, just if for those that may have children, I know a lot of people are still working, are essential workers. And as a professional, as a teacher, I just want to say, thank you all for, you know, being patient with us as everybody is converting over to this e-learning for the rest of the school year. But in the meantime, just keep the kids engaged, keep them, you know, try to give them a schedule or try to set a schedule. I know it is kind of difficult if people are still working, but however, if you could give them just like a 9 to 12 type of schedule just to keep them going. Just as far as like our mental health is important, theirs is too. And this is kind of difficult for them as well. So with that said, I did upload to Client in the group on Facebook a list of educational resources. If people want to go through those, they're free for the kids to keep them engaged. And as I come across more either professional development workshops or things for the kids, I will post them on there as well. And if you have any questions, I'm Jaquette Montgomery, and if you want to shoot me anything from Facebook, I'm more than welcome to help anyone within the education field as well, as far as teaching. And that's pretty much it. Thank you.
Thank you, Ms. Montgomery.
You're welcome, girl.
Are there any other updates or comments from folks?
I will speak on behalf of Kayla, my daughter. I know at the unfortunately she's one of those, you know, children that's not on a time schedule. I'm working on that. But she has been diligently working. I did speak with her regarding our last call, and someone mentioned scholarships for students at this time with the students being out of school. And she has been creating an Excel spreadsheet that includes scholarships that are still available for students. And she will be sending that over to upload. A lot of the scholarships, and what she's found out, well, there is some scholarships that are closed because during the winter break time, that's when they open. And a lot of them are just closing like at the end of March, within the next couple of days. But there are some other ones out there. So just having that in the database, or having some of our students of all ages, because not just focusing on the seniors and juniors, but of all ages, being able to write those essays or apply for those easy 1,000, 2,000, 5,000, 500, any dollar amount counts, just to keep their minds going, and allowing them to access those during this time that they're at home.
Absolutely. As Nakia mentioned, her daughter is the chair of our youth advisory committee. And she and another young lady that is based out of Georgia are working diligently to get some of the information that we're compiling out to the youth. So doing it from a youth perspective. I'm young, but maybe I'm not young enough because we need a youth advisory committee. But they're working really good. They have a lot of great ideas. I know that Catalina, who is the other young lady that's in that committee, wanted to be on the call. I think she was having some technical difficulties, but she did have an idea that she wanted to pitch. So maybe next week, if you all return, we can hear from the Youth Advisory Committee as well. And in regards to resources for youth at this time, I know that locally, the Skillman, well, not locally, but the Skillman Foundation is a really, really great resource for scholarships as well, and information for youth. And then there is also a resource that that I found that talks about specifically resources for under-resourced students and students with developmental needs and challenges. And so we're trying to get that up on our website as well. Going to pause to do a little ad. If there is anyone on the call that has a minute, we did have a volunteer who volunteered to sort of siphon through all of the resources that are in our COVID email account. But she is a student in its finals, so I told her to put her studies first. So with that, though, we do not have someone that is actively processing those emails from that account and putting it on our Google Drive. So the information is just sitting there waiting to be found and used. If anyone has time and can devote or dedicate to doing maybe an hour a day or something, just to go through that email list and translate it into something that can go into a Google Sheet, please let me know. You can chat me privately or message me or Nakia, whose ever contact information that you have.
And also, if you know or you have students or children who want to participate in the youth committee and assist with finding scholarships or participating even in going through the drive or email or anything simple. My daughter's only 11, so we are looking for a range of ages that can participate. The two that we have now, they, like Taquania said, they have been diligently working on ideas, and even at their age, their ideas have been amazing on how to help kids at this particular time. So if you have youth, also what they were telling me is some of the scholarships are private, and some of those private organizations do have difficulties getting that information out to everyone. So they don't have the resources to advertise or market, or they're not a part of those paid scholarship websites. So if you have church scholarships, organizational scholarships, or private people who are giving college scholarships, send those our way as well, so we can list them, so we can make sure that they are using those funds to help students and that the students are being paired with those as well.
And just on cue, our youth Advisory Committee member that I was just talking about just joined the call. Hi, Catalina. We just got finished talking about some of the work that you were doing, but I kind of briefly talked about the idea you had in relation to GoFundMe. So I didn't know if you wanted to talk to everyone about your idea a little bit more.
Okay, yeah, that'd be great. Hi everybody. So I'm part of the youth committee, and one of the ideas we had for helping people during this pandemic was having a GoFundMe account, and we would just have people donate. We would have people actually post about the GoFundMe account on their social media. That way we could get donations. And I just wanted to ask if any of you guys have any particular hospitals, because we plan on using this money to donate to hospitals and other medical organizations. That way they can get all the medical supplies they need, since that's a big problem right now. So do you guys have any suggestions or any opinions on where you would like the money to donate to particularly?
So thank you, Catalina. What I will say, I know locally, a lot of cities, like the city of Detroit, and you can check with your cities as well, and I can assist anyone with that who does not live locally, but they have a sign-up sheet for businesses to donate either PPE, personal protection equipment, or things like that, or even volunteer to be a reserve medical professional on reserve, so that you can volunteer to assist in treating or assist hospitals in meeting their demands. And so I know locally there's some online forms that you can do. You can also contact your health department, your local health department, and find out which hospitals are in most need, and go that route. But I do know locally, pretty much all our hospitals, so Beaumont, Henry Ford, all of them need as much as they can get. But as far as other states, that would be my recommendation. Does anyone else have any comments or thoughts for Catalina?
No, that's fine. What was that city that you mentioned, Tikayan?
So for the Detroit.
Okay, Detroit. Okay.
Yeah.
Thank you.
You're welcome.
I will say, this is Jaquette from Chicago. You sound so adorable, number one. But sorry, stay on track. But I will say our governor, just like you all's governor, come on every day. He has a certain email address, because of course he's asking for medical supplies as well. Maybe I could talk to Taquan outside of this, and I can give her the email address if you are interested in doing another city or state.
Yeah, definitely. Yeah. Thank you.
You're welcome, hon.
Hi, this is Kayla.
Hi, Kayla.
Hi.
Kayla, we were just talking about the Youth Advisory Committee and talking about some of the things that you all were working on. Catalina talked about the GoFundMe idea that you had for raising money for hospitals. Did you want to talk about anything that you were working on? Your mom talked about the scholarships a little bit, but I didn't know if you wanted to talk about it from your perspective.
No.
Okay. All right, are there any other questions or updates? I want to make sure, I know I kind of glossed over, just circling back, I know I kind of glossed over some of the support available to small businesses, churches, nonprofits, business owners, and that sort of thing. But I really want to make sure that everyone is able to take advantage of all of the resources. So does anyone have any questions about that stuff or anything else that I have mentioned thus far? If not, I will switch over to closing remarks.
Taquanya,
Yes.
I'm sorry. I have a couple questions.
Okay.
We have a few people who are shy, and I'm getting text messages, so I'm just going to read
You can
them.
also use the chat feature. So you can chat people individually so that we don't have to look at our phones. But go ahead.
So the first question was, can unemployed workers get food benefits? I'm not sure if I have to do more research, but I do see that there's an article that says yes. I'm not familiar. I would have to do a little bit more research to find out if they are able to, but have you seen any information that's saying that they can also qualify for food benefits?
You mean like a EBT, like that sort of stuff?
Yes.
Yes, you can. Yes. There's also, I mean, at least locally, there's so much, not to say that you have to go that route and get donations, but there is a plethora of free food available to the community. So if you are in need of food, I know a lot of school districts and recreation centers have food food pickups available for the community. It used to be that you have to have kids and all of that, but they relaxed those restrictions. But yes, you are eligible.
Okay. And then and then the other question was, I think we just need to be clear where our information is loaded, so anyone can access all of these, the information.
Yeah. We'll be a lot more clear once it's ready for you. But we do have, so on our website, Nakia, can you type our website in the chat? But on our website, we do have, so www.mifreedomcf.org. We do have a COVID-19 page. And it's available right from our menu. So as soon as you get to our homepage, you'll see it. I think there's even a pop-up that happens if you scroll a little bit. So on that page, you'll see the link to the Google Drive that we're trying to build. If anyone on the call wants to help us get that prepared, it's not there yet, but also you're able to submit any resources that you have, apply for support, request help. You can access our emergency assistance application from that site. And you can also donate or spread awareness about what we're doing. We do, I don't know if everyone's able to see their chat, but one of our newly elected board members, Ms. Peoples, did mention that there is a Meetup and Eat Up. The Meetup and Eat Up program is available in several cities as well. I know also there are some delivery options for seniors that I'll also post on the site. So if you're a senior or have disabilities, there are free food delivery options available.
I want to add one thing too. This is Dana. MDE just released a guide today for social and emotional support for students, and it's geared toward educators, but obviously parents are the educators right now. So the information is really good for parents because it does offer resources for students with special needs or emotional needs, resources for domestic violence, things like that. So it is it's about 11 pages long, and it just kind of gives you a guide as an educator and as a parent as to how best support students during this time, because it is a crisis. Like, I find myself asking my daughter how she feels about what's happening right now a lot, instead of making it so much of a structured time like a regular school day. So I think that will be something as well that we could maybe upload at some point as a guide for parents.
Absolutely. Thank you for that.
No problem.
Did you have any other text questions from folks, Nakia?
No, that's it.
Okay. Any other comments or questions from folks on the call before I wrap it up?
One thing, could we add, when I create the GoFundMe account for raising money for the medical supplies, could you add it to the COVID-19 page that you have on the website?
Absolutely, yes.
Thank you.
Okay, well, I do first want to thank you all for your time today. I know it's the end of the day, and it can be kind of taxing to hear a lot of this information. But again, we want to do our best to make sure that everyone is informed and we're able to equip ourselves with many resources as possible, given the fact that minorities and African Americans are suffering disproportionately right now. So you all are part of the Army, so go forth. Don't just hold on to this information, share it with as many people as you can. Make sure that you come back next week. Again, we're going to be having these calls every week, so invite a person so that we can make sure that we can get this call out. I will be sharing a recording of this call to everyone that is in my email listserv. So we have a MailChimp account. So anyone that has an email or that got an email about this call from our Minority Freedom Community Fund MailChimp account, you will get a recording of this. If you did not get that email, that means I don't have your email address. So please give that to me, either leave it in the chat or you can text it to me at 586-252-1339. I want to remind you again that we do have an email address. So if you're browsing the web or you see a picture or whatever it may be, and you just want to send it to us really quickly, you don't have time to write about it or come up with something fancy to say, you can just forward us that email, that article, that picture, whatever it is, to our email address that is specific to our COVID-19 Special Task Force. That email address is COVID, COVID, at mifreedom, C as in Charlie, F as in Frank.org. You can also text us at 810-377-5165 and follow us on Instagram, Twitter, and Facebook. Our username is mifreedomcf, just like our domain. I want to remind everybody to complete the census. We did not talk about this last time, but make sure that if you have not already completed the census, to do that, you can go online to my2020census.gov. If you don't have the little code that they mail to you, you can scroll down and select I don't have a code and fill it out. It takes 3 seconds. I want to remind you that you want to respond for if you don't live at the place or you aren't primarily at the place that's on your ID or your driver's license, you want to respond according to where you spend the most of your time. So if you're using someone else's address for whatever reason, but you spend most of your time in another city, you want to respond for that address to make sure that the federal dollars are distributed accurately. You can also call to complete your census. So the number is 844-330-2020 if you would like to call to complete your census. So share that information with your networks as well. I'll share a recording of this conversation. If anyone would like to exchange contact information and you haven't already done so, I encourage you to do that in the chat before we get off. And thank you all for attending. I hope you all have safe nights and continue to be healthy, and prayers to you and your families.
Thank you so much. We hope you have a great night as well.
Thank you.
Bye.
Good night, Melanie.
Have a good one, Al. Thank you.
Bye, everyone.
Bye-bye.